there are different ways to go to the center. There's not just one way of reaching the center. What you would see with Dr. Rajan is one way of doing it. What you saw with Dr. Divya is another way of doing it. But the place where this two integrates together is if you really listen to her, or if you really understand the essence what he is doing it. What is sensation? The question that I ask you, what is a sensation? What is sensation homeopathy that we talk about? What is the experience that we talk about? Sensation is the experience. A lot of cases we select rubrics. Right? This is what you see Dr. Rajan doing it. But in a case, he selects some rubrics, and in the next case you see a different pattern. The pattern is not the same. Because you have to select the rubrics which conveys the essence. For example, in the Calcarea Sulf case that we saw in the morning, right now, a few minutes back, I would simply select a very basic rubrics of Calcarea and sulfur for me. That's very, very simple. What rubrics you select, it depends on the case. They also selected a lot of rubrics, but the understanding was based on a completely different thing. So, the sensation homeopathy, what we see is we go to the experience and we prescribe. Sensation is the experience. But we had a good discussion with Dr. Divya. What is the experience? Or what is that central thing? Which rubrics to select? That's the essence. She helped us with a very beautiful tricks to come to the experience. For example, you find out with 5 senses. So you use those questions to take the patient to an experience. It was so surprising. Yesterday I had a case. The patient was in Connecticut, and I took her case. I took her son's case. The child was 10 years old, and I took the whole history in detail, and I understood very well. And just to confirm, I asked mother's history during pregnancy, and the same history came up. The child who had this kind of sudden unexpected fear, and that fear would paralyze him, and he would wait and observe. His main thing was that you just wait and observe the other person's movement. There is a sudden fear that which way to escape, or if no escape, strike. And then when the same thing, sudden fear, fear of unexpected things, fear of very high places, lot of things were there. I'm not telling you the whole case. And then I took mother's history. Mother had a very intense dream during pregnancy, and that suddenly she would wake up and she would see somebody standing there, and she would just wait in the bed and trying to gauge where is the other person moving and what is the kind of escape route for her. And she had this unusual, the child would not talk to people. In fact, before I started the case, when mother got the computer in the room, child's room, I couldn't see the child. I said, where is he? The child was lying on the floor. I said, why? Because he wanted to hide from me. And then mother said, and this was exactly, now I can recollect that this is how I was. Why? Is that I never wanted to mix with people, because I couldn't make out in the group that who's the good person and who's the bad. There could be a mugger, or there could be a person who has a bad intention, and I had to develop a special ability to gauge who's good and who's bad, and prepare myself for the escape route or attack back. So it is kind of, if I'm very well prepared, I know what to do, how that person will move, and I know how to react back. So the interesting thing was, the experience which she developed was with using the same technique. She was not going forward. Then I asked her, how does it feel physically? How do you express, if you have to express it with your senses, like with your touch or with your smell or with this kind of thing? And then she went forward. So what we can do, and the remedy that came up was elapse in both the cases, where she had a feeling that something is, she's going deep into an abyss, or deep into a hole, going deep down it, and there's just endless, and there's no hope, and she's just going sinking deep into it. And the clairvoyance, and then a lot of other things came up. But in this case, what helped me is to ask about the experience using this technique. So what we can do is to come, what is the most important central point of the case? Whether it can be a simple rubric. See, once you understand the essence, then whether you search that into repertory, you search that into materia medica, or you search it into sensation. Like last case, moment I knew that his sensation has to do with this ego and the security. So for me, it was easy to search it in the sensation. Sometimes you can search that peculiarity, that essence into materia medica. Sometimes that you search into repertory. But you come to that essence. You use different techniques. You can ask, what's your experience? Ask about their touch, smell, sound, vision, and you will come to the same experience. Because the center is one. It's not different.